Hello, welcome to your 2024 Benefits webinar. The plan year for this year is January 1st, 2024 through December 31st, 2024. This will be going over the benefits guide that is available in Employee Navigator. Here is an overview of what's inside this guide. This includes important information such as your service team benefit rules, medical information, dental and vision information, payroll deductions, life and disability information, employee assistance program information, and colonial voluntary plans information. The Safeguard team is readily available to assist you with any questions over the phone or through email. This includes resolving claim issues quickly, helping you to understand your benefits, and resolve billing errors. You can reach us by phone at 866-522-9543 or by email at hpibenefits@safeguardgroup.com. Here is an overview of the benefit rules for the 2024 period. Open enrollment elections will be effective January 1st, 2024, and they will all be made through the Employee Navigator portal. New hires must complete their enrollment process within 30 days of receipt of your enrollment materials, and if you fail to enroll in time, you will not be able to enroll in coverage until the next annual open enrollment period, unless you experience a qualified life event. So who's covered? You, as the employee, are covered if you are a full-time, permanent, active employee who is directly employed and compensated for services by your employer. Additionally, your family, including legal spouse, dependent children up to age 26, and dependent children who are over the age of 26 but are still fully dependent on you, are also eligible to be added to your plans. Now, due to IRS regulations, you cannot change your elections until the next annual open enrollment period unless you have a qualified life event during the year. This can include marriage or divorce, birth or adoption of a child reaching maximum age limit, death of a spouse or child, change in child custody, change in election coverage made by your spouse during his or her employer's open enrollment period, or you lose coverage under your spouse's plan. To make changes to your benefit elections, you must contact your Human Resources Department within 30 days of the qualified life event, including the birth of newborns. You will only receive new ID cards for your medical coverage if you are changing plans or if this is your first time enrolling in coverage. You will not receive an ID card from MetLife. Dental and vision ID cards can be downloaded at metlife.com/mybenefits. The overview of 2024 is that benefit election options will not be changing from 2023. Your insurance carrier will continue to be independent administrators, with your dental, vision, life, and disability carrier continuing to be MetLife. The health reimbursement arrangement will continue to be administered through the Harrison Group, and you will also be using Employee Navigator for online enrollment. Here is an overview of the two medical insurance options offered by independent administrators. This includes a base plan and a buy-up plan. The base plan is a deductible first plan. For individuals, the deductible is $4,000, and for families, it is $8,000. What this means is that the deductible must be met before you can get to copays. So once your deductible is met, you will have a $20 copay for primary care physicians and a $40 copay for specialists, a $10 copay for telemedicine, as well as a $40 copay for certain physical or occupational therapy or chiropractic care. You will also have a $70 copay for certain labs, x-rays, and blood work. These are all after deductible. If you're curious about the copay after deductible for a specific treatment that is not listed, please feel free to contact us here at the Safeguard Group. Additionally, your prescription drugs under this plan do follow the same deductible first as your medical benefits. For generic drugs, this is a $20 copay. For formulary brand name drugs, this is a $40 copay. Non-formulary brand name drugs is a $70 copay, and specialty drugs is a $150 copay, with mail order RX for up to a 90-day supply being 2 times the retail copay. All of these are after you meet your deductible. Additionally, Hansen reimburses the first $1,000 for individuals or $2,000 for families of your deductible. This will be on the HRA debit card that you will receive preloaded. The buy-up plan, unlike the base plan, is a copay first plan. So you do not have to meet your $2,500 deductible for individuals or $5,000 deductible for families before you reach the copays. So this means the $20 copay for physicians and the $40 copay for specialists, the $10 copay for telemedicine are all available instantly. You also would have a $40 copay for physical and occupational therapy and a $40 copay for chiropractic. Certain labs, including blood work, would have a $0 copay, with x-rays being a $40 copay and MRIs being a $120 copay. Additionally, your prescription drugs do not also have to meet a deductible before you're able to reach the copay, which means you have instant access to a $20 copay for generic, $40 copay for formulary brand name, $60 copay for non-formulary brand name, and $100 copay for specialty drugs, as well as the 2 times retail copay for mail order up to a 90-day supply. Hansen does reimburse certain costs under the buy-up plan with the HRA. This includes up to $1,500 for individuals and $3,000 for families. This is only applicable for certain surgery and hospital inpatient procedures. Here is an overview of your telehealth options through MD Live. You will be able to visit doctors for specific pediatrics and family medicine that can treat light issues. This includes acne, cough, insect bites, or sinus infection. You can do this by going to members.mdlive.com/IBX, calling MD Live's customer service at 1-877-764-6605, or downloading the MD Live app. You will need your Independence Blue Cross member card if you are registering on MD Live's website or by phone. Here is a continued overview of the HRA reimbursement, including the individual and family options for both the base plan and the buy-up plan. If you have any questions on this, please contact us here at the Safeguard Group or your HR administrator. Here is an overview of the Connect Care 3 benefits that are available to you. Connect Care 3 can offer patient advocacy, nurse navigation, chronic disease management and prevention, nutritional education, and tobacco cessation. To enroll, please call 877-223-2350 or email info@connectcare3.com to enroll in their services. Here's an overview of the dental insurance offered by MetLife. Both options have in-network and out-of-network benefits, with the primary differences being through the annual maximums, the percentage covered, and orthodontists. For the high option, the annual maximum is $1,500 with annual deductible of $50 for individuals or $100 for families. Preventative services are covered at 100% for both in-network and out-of-network. Basic services are covered at 90% for in-network or 80% for out-of-network. Major services are covered at 60% for in-network or out-of-network at 50%. Orthodontists for both adult and child are covered at 50% for both in-network and out-of-network. The orthodontia lifetime maximum is $1,000 per member. For the low option, your annual maximum is $1,250, with your annual deductible being $50 for individuals or $100 for families. Preventative services are covered at 100%, with basic services being covered at 80% for both in-network and out-of-network, major services covered at 50% for in-network and out-of-network, and orthodontics covered for only children at 50% for in-network and out-of-network. Orthodontia lifetime is still $1,000 per member. Your vision insurance will be through MetLife this year. There is only one option for vision insurance. The frequency of your comprehensive exam is every 12 months with an in-network $20 copay. Lenses are also covered every 12 months with a $20 copay for single, bifocal, trifocal, and lenticular lenses. Frames are covered every 24 months, and they have a $130 allowance. Elective contact lenses, in lieu of getting regular glasses, are covered every 12 months with a $130 allowance. Out-of-network uses only allowances instead of copays. This is the maximum that the insurance will reimburse you if you go to an out-of-network provider. This includes a $45 allowance for comprehensive exams, with lenses having $30, $50, $65, and $100 allowances depending on the type, frames having a $70 allowance, and elective contact lenses having $105 allowance. Out-of-network is still liable to the same frequency as in-network. Here is an example of your dental and vision ID cards through MetLife. These have the group numbers on them, and if you would like to receive your own, you will not be sent one automatically, so please visit metlife.com/mybenefits. Here is an overview of the 2024 payroll deductions. For medical, under the base plan, employee only is $83, employee plus children is $140, employee plus spouse is $188, and family is $218. The buy-up plan for employee only is $140, employee plus children is $228, employee plus spouse is $282, and family is $318. Remember, these are per payroll deductions. For dental, the low option for employee only is $1,222. For employee plus children is $31.76. For employee plus spouse is $24.32, and for family is $43.87. For the dental high option, employee only is $15.88, employee plus children is $38.36, employee plus spouse is $31.80, and family is $54.18. For vision, employee only is $286, employee plus children is $469, employee plus spouse is $458, and family is $754. Here is an overview of the life benefits offered through MetLife. You have a life and AD&D benefit that is 1 times an annual salary to a maximum of $150,000 with a guaranteed issue up to $1,050,000 with age reductions of 35% at age 65, 60% at age 70, and 75% at age 75. Additionally, you can also get voluntary life and accidental death and dismemberment through MetLife. This includes the lesser of 5 times basic annual earnings of $500,000 with a guaranteed issue of $100,000, but this is only if you enroll when first eligible. There is no age reduction under this plan. This voluntary plan also offers spouse and child benefits. For spouse, it's $5,000 increments up to $100,000 with a guaranteed issue of $25,000, but only if you enroll when first eligible. Spouses and children can only be enrolled if the employee is also enrolled. Here is an overview of short-term and long-term disability through MetLife. The STD, or short-term disability benefit, is 60% of your annual salary up to $750 a week, with an elimination period of 14 days for both injury and illness. The benefit duration can last for 11 weeks. For long-term disability, you have 60% of annual salary up to $5,000 a month, with an elimination period of 90 days. The benefit duration is to the end of your disability or to age 65 or SSNRA. Here's an overview of the Employee Assistance Program through MetLife. This offers an easy-to-use EAP consultation for emotional well-being, family and relationships, legal and financial issues, healthy lifestyles, and work and life transitions. This includes 5 telephonic or virtual sessions with a counselor per household per year. And additionally, they also do offer in-person visits where they will try to match you with someone who is in network locally so that way you can continue to see them once your 5 virtual or in-person visits are up. To do this, please visit metlifeeap.lifeworks.com and use the username and password on the screen. And you can also call at 888-319-7819. Here is an overview of the voluntary colonial insurance policies that are available to you. The first is medical bridge insurance. Colonial Life's medical bridge insurance offers financial support in the event of a hospital stay and is designed to cover costs that your medical insurance might not. This coverage bridges the gaps left by regular health insurance, helping to offset expenses like outpatient surgery, inpatient services, diagnostic tests, and doctor's appointments and emergency room trips. The next is accident insurance. Colonial Life's accident insurance offers a crucial layer of financial support, helping you manage unexpected medical expenses resulting from accidents. This coverage provides reassurance by bridging the gap between medical costs and your primary insurance, allowing you to focus on your recovery instead of financial stress. For short-term disability insurance, it offers important financial support, ensuring you maintain an income during unexpected medical leave. This would be to bridge the gap between the company-offered short-term disability insurance and allowing you to voluntarily opt up for more. Additionally, there is critical illness insurance available to you. This offers support in the event of the specified critical illness, such as a heart attack, stroke, or major organ failure. This coverage bridges the gaps left by regular health insurance, helping to offset expenses like deductibles, coinsurance, copays, home health care, travel costs, and more. Colonial Life's universal life insurance provides financial security for your loved ones, ensuring their future stability in the event of your passing. This coverage provides a permanent coverage that has a cash value element and allows you to raise and lower your premium within an allotted amount. Additionally, whole life insurance is also available, which provides long-lasting financial security, giving your loved ones a safety net for life. This coverage offers a combination of protection and savings, building cash value over time. With Colonial Life's life insurance, whole life insurance, you can provide your family with peace of mind and a reliable foundation for their financial journey. If you would like more information on the voluntary products offered by Colonial Life, please contact Bob Roth at bob.roth@colonialdmmd.com or by calling 302-235-3088 at extension 7105. A new benefit this year is pet insurance offered by MetLife. This insurance allows you to customize your coverage, deductibles, reimbursements, and a wide range of discounts and healthy pet incentives through MetLife for both your furry and exotic little friends. To begin with this, please contact MetLife with the phone number that is provided on Employee Navigator. Here's how to reach Employee Navigator. If you are already registered, please go to employeenavigator.com and enter your username or password. If you have forgotten your password, please click the Reset a Forgotten Password button. If you're having trouble with this, or if you are not receiving the Reset Forgotten Password email, please contact us here at the Safeguard Group so that we may go in and help you. If you are logging in for the first time, please go to employeenavigator.com and click Register as a new user. Then type in the below credentials. This includes your first name, your last name, your company identifier, which is HP21, your PIN, which is the last 4 digits of your social security number, and your birth date. Once you have done either logging in or registering, you will see the home page. From here, you can enroll in benefits, clicking Start next to Open Enrollment and tracking your progress on the side of the screen. If you have any trouble, here is the contact information for independent administrators, the Harrison Group, MetLife, Colonial, the Employee Assistance Program through MetLife, the Safeguard Group, and Hansen Properties HR. We hope you have a great year, and please let us know of any worries, concerns, or issues that you are facing. Goodbye.